Good morning, everybody, and welcome to the webinar today. My name's Amy, and I'm the Communications Manager here at MorePay. Today, we're going to be talking about returning to the workplace. But before we do, there's just a couple of things to cover. So first up, you've probably noticed that your microphone is muted. It's not because we don't want to hear from you, it's just because we've got about 800 people registered today, so we just want to avoid any background noise. We have got a live Q&A at the end of the webinar, and our expert will do her best to answer as many questions as she can. So to ask her a question, just drop them into the panel shown here. If you're having any technical issues, you can use that same question panel. Now, hopefully there are no issues, and hopefully at our end, if it's something that we can fix, I'll do my best to fix it. But don't worry if there's a problem at your end in terms of internet connection or anything. The webinar is being recorded. I will share a YouTube link by close of play today, so you can re-watch the webinar at your leisure. So what are we going to cover today? Well, first of all, we're going to talk about when to return to the workplace and dealing with employees who perhaps refuse to go back. We're going to be looking at supporting the vaccine rollout and managing those who refuse the vaccine. And we're going to be looking at keeping the workplace safe, including mental health considerations. We have got a couple of slides in there about flexible working, because I know lots of you have questions about that, and we've already had a few through. Flexible working is a full topic in itself, though. So on the back of the queries that we've had, we've just decided to run another webinar dedicated to that. So that will be in a few weeks' time. I can send you an invite to it alongside the webinar link this afternoon. So look out for it. It's called Implementing a Hybrid Working Model. So it'll be looking at all the implications and obligations if you choose to do that, and a little bit about flexible working. So look out for that. Before I pass on to our wonderful presenter, I'm going to spend 30 seconds just talking about MorePay, just in case there's people on the webinar who perhaps don't know who we are. So we provide payroll and HR software, as well as managed services to businesses across the UK. We've been around for more than 50 years now, and we've got about 10,000 customers. We promise to make payroll and HR easy, and we do that by focusing on these things. So simple onboarding, easy to use software, rich functionality, which basically means we pack our software with features and automation to make things easy for you, and then finally flexible services that are delivered by a huge team of payroll and HR experts here at MorePay. So that's us. I'm going to talk a little bit about our presenter today. So Michelle Hobson is our HR Services Director on our senior leadership team. She's been with MorePay since 2017 and has more than 15 years of experience in both operational and strategic HR. And of course, she's CIPD qualified as well. So great to have you on the call today. Hi, Michelle.
Hello.
Good morning. Welcome. I will hand over to you.
Thank you very much. Okay, so a huge hot topic at the moment about deciding when to return to the workplace. And I think even whilst we've been pulling together the content for this webinar, things are changing rapidly. Things are starting to ease. We have a road out of lockdown, but then we all know that within the last week, there's been a new variant identified with particular hotspots around the country. And there's a lot of speculation in the media about what that will mean in terms of lockdown restrictions easing at the end of June. But what we'll do today is talk through where we are as of now and the things that you should start thinking about and might want to start thinking about, and to help you with that planning. And, you know, as things change, we will update our guidance as a business and support you, and we are keeping on top of all that. But it's important to take a step at the moment and look at where we are now, and we will focus on that, but just with the caveat that things may change. So as of yesterday, the government confirmed that the rules have eased again in step 3 of the route out of lockdown. And a lot of this was around hospitality and the opening of indoor venues. And that has obviously got a lot of implications for lots of businesses, including businesses that we support as MorePay. It's great to see that our businesses are able to open their doors again in hospitality to indoors, and other things like cinemas and other indoor places are allowed to open. In terms of work, though, the advice is to still continue to work from home where you can. And at the moment, that advice is going to stay the same until the next stage of the roadmap on the 21st of June, pending any update or changes as they may happen. You may let your employees return to work, though, where home working isn't appropriate. And there are a number of reasons why home working may not be appropriate. This could just be down to the home environment, mental or physical health challenges that may mean it's more appropriate. And I think that the thing that's changed in comparison to the past is that you do not need to be classed as a critical worker to now go into work. So there is scope for allowing businesses to think about reopening where they hadn't necessarily done to before. So what you're finding is a lot of businesses are now planning that their employees can return from the 21st of June, where there is a hope that there will be an end to, at the moment, they're saying there'll be an end to all the restrictions, but we know that that may differ over the next few weeks. But lots of organisations, including our own, are getting in place plans to reopen from the 21st of June. As it stands, though, if you do send people back into the office, all the COVID secure rules are still in place. They continue to apply to a workplace. So on to the next slide. I think what we've decided to do is kind of jump straight in with the real hot topics here. And the main question that we're getting asked at the moment is how to deal with employees who refuse to return to the office. Now, black and white in terms of employment law, if an employee refuses to do as instructed, then they are considered to be breaching their employment contract and may face the possibility of being dismissed. However, there's a level of complexity that you have when it comes to dealing with COVID, and where an employee reasonably believes that they are in serious or imminent circumstance of danger, then they can refuse to return to their place of work. And that's the serious consideration that we have to give, and it adds quite a level of complexity to dealing with it. So for those of you who are on this call now, there isn't going to be a black and white rule around if somebody refuses, this is what you do. It's all going to be very dependent on their reasons for refusal, all the things that you've got in place. But what we're going to do today is try and help you think through that. So if an employee was dismissed in these circumstances, especially around something that is so new and novel to us all, yes, it has been around for 14 months, but in terms of dealing with this as an employment law issue, this is continually changing. And COVID is still a relatively new thing in terms of employment law. If an employee was dismissed in these circumstances, you've got to remember that they could make a claim for unfair dismissal, and that could be considered automatic unfair dismissal. So one of the main things we have to think about, it's not what you as an employer believes is reasonable or not. It's whether that employee's perception can be thought of as a genuine risk. Have they identified a genuine risk? And at the moment, with all the things still around social distancing, around the guidance to still continue to work from home, I think there will still be a serious question around that. Does the employee have a reasonable concern? And that's the differentiation. With COVID, workplaces will still carry risks. So we've got to make sure that the right safeguards and policies are in place before reopening. But you do need to remember as well that you can't allow an employee to suffer a detriment for refusing to attend work on health and safety grounds. To talk about this in a bit more detail then, just going on to the next slide. You have got options about managing a refusal to return to work, and that's what we want to talk through. If someone is refusing to return to work, the first thing you should always do is talk to them informally. Understand exactly what their concerns are and why they have a concern. If that concern still remains, then you can deal with this as a normal flexible working request. If they ask to continue working from home, then you can deal with this as a flexible working request. We'll touch on this briefly throughout this webinar, but as Amy said, we are going to do a full webinar on flexible working and hybrid working. You could agree for them to remain furloughed if they are already on furlough for as long as the furlough package is in place. Obviously, we've been given an end date at the moment. Whether that will change remains to be seen, but that is an option. You could offer them the use of annual leave or even some kind of unpaid leave if that is appropriate whilst you are getting things in place. But obviously, this is all about getting them to a place where they feel comfortable and you come to an agreement about what's best for you and for the employee. The last option then is to go down a disciplinary route. If you come to the conclusion that there's everything in place that needs to be for that person to feel safe and secure, if you have gone down all the options of looking at flexible working, hybrid working, but still feel there's a need to be in the office and the individual refuses, as long as you have those appropriate workplace safeguards in place, then disciplinary is an option that you could look at. What we would caveat that with is that each circumstance will be individual and there isn't going to be a blanket approach to this. And it is also something that we all need to tread carefully with. So I would either get the advice of your internal HR team, or if you're one of our HR services customers, then please contact the advice line to talk about that specific instance. I will reiterate again, though, that one of the key things is to keep the lines of communication open with your employees and to have those open and honest conversations. It may be that those conversations can help alleviate that individual's fears about returning to the office. I think there is still a grey area at the moment, whilst the government are still saying that they would like employees to work from home where possible. But we hopefully are going to move to a position where that is lifted. And then that will give businesses a stronger position to decide what is best for their businesses and their employees overall. So then, looking a little bit at flexible working options, if we are returning to some kind of normal life, both in and out of the workplace, I think one of the things that is going to come from this, and it's inevitable, and a lot of businesses are looking at this, is how employers harness more agile and flexible ways of working to meet the new expectations of employees. I think in most instances, there have been stories of success of home working that we've kind of proved as a nation that it is possible. Whether that's the most efficient way remains for an individual business to decide themselves, but there's certainly been efficiencies and benefits proven to it. So there are some businesses who either want to consider long-term home working or some kind of hybrid model where previously you might have had people in the office 5 days a week. You might want to consider a move to half the time in the office, half the time at home. And these are some of the considerations that you need to think about when you're looking at these flexible working options. In terms of people working from home, you still have obligations to make sure that their working environments are safe. A lot of us have considered the last year to be a business continuity situation, which may mean that we were slightly more relaxed in terms of safety and risk assessments. But if you're planning on moving this to a more permanent option, have you carried out the right work assessments, the workstation assessments, the provision and maintenance of equipment in the home? What are your obligations there? And they're things you need to consider about. A big thing is to think about suitability and employee well-being. How does home working affect mental health? Do you have things like an EAP in place so that employees can access confidential support and advice? How will your management team feel empowered to be able to continue to manage a team on a more permanent basis, being at home, whether that's part-time at home or permanently at home? How do they make sure that their team's kind of mental well-being is being considered when they're not physically sat in front of them? You've also got to think about what the impacts are on contractual terms. Do your contracts allow for that degree of flexibility, or is there a change going to need to be made to that contract? Again, seek specialist advice at that point. And if you are looking at making contractual changes, how have you communicated that to the employees? What does that mean in terms of their agreement or otherwise? You need to think about things around software and hardware and data. Are things secure? Are their working environments secure? Do they have a discrete workplace where things can be locked away? What about cybersecurity? As I said, it's all going back to this thing that if it is going to be on a more permanent basis, there may be more stringent rules that you need to put in place. There's lots to consider. And then, as I said before, this is all about managing as well, monitoring, engaging with employees. How do you manage performance? Are you making sure you're having your regular one-to-ones? How do you replace those small conversations that you might have had in the office to make sure that you've got a temperature check on your team? These are all the things that need to be given a lot of consideration if you are moving to more of an agile way of working. And this sort of approach should always really be backed up by a policy where the company clearly lays out its thought process around agile and flexible working. So on to the next slide then. If you get an employee who puts in a flexible working request, and as I said before, we're going to go through this in a lot more detail on the next webinar, I just think it is worth calling out what the grounds for refusal are for flexible working requests. So there are 8 official grounds for refusal. The first one is around the burden of additional costs to the organisation. The second one is around an inability to reorganise work amongst the existing staff, inability to recruit additional staff. It may have detrimental impacts on quality or on performance, or it may have a detrimental effect on the ability to meet a customer demand. There may be inefficient work for the period that the employee proposes to work, and that may be that there's a planned structural change to the business which impacts on that. These are the 8 things that you need to consider in general for flexible working. This isn't specific to COVID, and some of these may not apply to COVID because it may not be somebody asking to reduce their hours, they're just asking to work their hours in a different way. But it's important to remember that as is, these are the only 8 grounds for refusal of a flexible working request. But again, if you get a flexible working request in, you need to follow the process, you need to give consideration, you need to hold the relevant meetings, and it's always best to do that with HR support. Okay. So the next biggest topic that we are getting queries about is around vaccines and what to do around supporting the vaccine rollout. Just excuse me, my doorbell has gone and my dog is barking, as you can hear, which is just proving exactly what it's like working from home. Just bear with me. Okay, so if we go into the next slide, please, Amy, around the vaccine rollout. So the biggest thing I think employers can do here is emphasise their stance on supporting the vaccine rollout. We've got to remember that vaccinations have not been made mandatory, and this hasn't changed for COVID-19. So if you think back to all the vaccinations that we were either given as children or that we have given our children, it doesn't come up in later life as a condition to either a workplace or to entrance to a cinema or to be able to go on holiday, whether we've had that vaccine or not. As it stands, the COVID-19 vaccine is not mandatory, and that's not due to change at the moment. But this is kind of a little bit counterbalanced with the fact that the Health and Safety at Work Act of 1974 means employers must take reasonable steps to help reduce workplace risks. And COVID-19 is a reportable disease under the Reporting of Injury, Diseases and Dangerous Occurrence regulations known as RIDDOR. And that has posed a lot of questions from employers who want to encourage their employees to take up the vaccine as a way to make their workplaces more COVID secure. So employers certainly have a justification to encourage their employees to be vaccinated, to help protect themselves and then to help protect everybody else in the workplace. So employers should really plan for vaccine implications for staff and visitors. What are the communication plans to help encourage take-up? Do you need to look at risk assessments and look at what your options are if there are a certain proportion of your employees who are not vaccinated? What are the implications? And it's just making sure that you consider these implications. And then some organisations may actually look to wrap this all up in a vaccination policy. There's certainly no standard for you to do this. It's not something you have to do, but it's something that companies are considering. But again, you've really got to think about this policy and all of the contractual terms, data protection, and the policies that sit around this, and what are the implications of this. It's quite a complex process. So on to the next slide then. A vaccination policy can be part of an overall COVID-19 secure and what you'd consider steps towards maximising the number of employees who can attend to work safely. Do remember though that this needs to be part of an overall matrix. It isn't a substitute for the other measures. All the other measures that you need to have in place around, at the moment, social distancing, all things like that still need to remain in place in your risk assessments. But if you do look at having a vaccine policy, this should outline your stance on the vaccine, which for the most part will be strong encouragement, help explain the role and expectations on managers, on HR, on employees themselves, think about the legal aspects of it. And one of the biggest things to think about is to make sure that you don't fall foul of discrimination claims, where someone is feeling that they're being discriminated because they haven't had the vaccine. That's particularly important if they haven't had the vaccine for a health reason, which could be classed as a disability. But your policy would also provide information on data protection and health and safety duties. Again, there isn't really a hard and fast rule that we can give you to say this is what your vaccine policy should say. And if someone refuses to have the vaccine, that here's your black and white answer. Again, it will be all very dependent on the individual circumstances. But things like a vaccine policy can really just help emphasise your company's stance on encouragement of vaccinations and helping your employees to understand why that is. So to follow on then on the next slide, the big burning question is, what do we do about those who refuse to take the vaccine? And as I said before, there is no government regulation that forces an individual to have a vaccine. And we've no reason to think that vaccines, including COVID vaccine, could or ever will be made compulsory, which leaves us with a grey area. So you certainly, as a business, cannot make someone have a vaccine. You can, of course, strongly encourage the take-up of vaccine in your workforce. And things that you can do that are practical is by giving people paid time off to attend the vaccination appointments. But then the biggest thing is going to be around meeting with individuals to try and understand their reasons and make sure that they have the facts around why you as a business think it is important. Obviously, we don't recommend that you insist someone has a vaccine against their will, and that is not something that anybody has the authority to do. But we just stick to the thing that we'd advise you to talk to anyone in this position and try and find out their reasons and see if you can alleviate their fears about not having the vaccine. But all this can be supported with a comms plan on your stance, encouraging them to take the paid time off when they need to attend vaccine appointments, being open and honest and talking about how vaccine fits in with your overall COVID secure plans and help for returning to work. And then that kind of leads on to just in general about keeping the workplace safe. The vaccine is obviously only one element, and to a certain extent, the very fact that you cannot insist someone takes the vaccine means that it's a little bit out of your control, although there's things that it can help. But just to finish off on this, what are the things that we can think about in terms of keeping the workplace safe? I think it's really important that we've got clear procedures that employees know, are aware of, that they should follow in the workplace, but also now thinking about what those procedures look like for at home. If you're going to continue with home working in any form, and we're moving out of a BCP situation, what are the processes and policies that need to be in place to make sure people are safely working from home. You know, and for example, not sat on their bed all day with their laptop on their knee. What are the things that you need to put in place? If your premises have been closed for a while, like many of our premises have, it would be wise to consider a deep clean before reopening, and then continually maintaining hygiene measures to minimise the spread of infection. So all the good work that we started to do just before the work from home announcement was made, there were a lot of things that businesses have put in place. It's picking those up again, and those things are likely to stay in place even beyond the sort of the reduction of COVID secure workplaces with the rules and regulations. I think there'll be things that will remain in place around hand sanitisation, effective hand washing, and all those kind of good things that we will take about. Do you need to provide additional PPE, gloves, masks, the hand gel? We need to look at what rules are in place at the time. We still don't know whether the mask mandate will remain beyond the 21st of June, what that will mean for workplaces, but it's certainly there now in terms of indoor settings, so it would be wise to consider it as it is now.
Oh, just had a little bit of issue with your sound there, I think, Michelle. Sorry, everyone. I think when we were testing just before the webinar, there was a couple of issues with Michelle's headset, so it sounds like it's just phased out there.
Yeah, am I back now?
Oh, so yeah, you're back. All good.
Yeah, so it's around considering what you need to do to keep those particular areas more hygienic. With the rules at the moment, in terms of staying 2 metres apart still, that may change again, but if it is 2 metres, consider how staff stay 2 metres apart in areas such as walkways, toilets, kitchens, lifts. How are you going to put that in place? We've been doing a lot of work in our offices to try and get them COVID secure in line with the regulations as they stand now. And what does that look like for your organisation? Are you extending operating hours to facilitate social distancing? Do you need to change contracts with your employees if you are staying open later or opening earlier, or is that already included in your contracts? And then think about what that impact that has on first aid and fire marshals being in the building, because there's still an obligation to make sure that you've adequate coverage and protection. And then another thing is looking at ventilation, preferably through fresh air or mechanical systems that help reduce the spread of the virus. And I think all of these things are considerations that businesses have been thinking about for quite a while now, but will come back in earnest now. We are looking to reopen the workplaces and at the moment continue to be COVID secure as per the guidelines, but I think there will be a lot of these practices that will continue in the future as just good measures. One of the final things that we want to touch on then is around considering mental health, because for example, where you've got an employee who is refusing to come back to the office, or an employee who is refusing to have the vaccine, and you think that may have an impact on your ability to be a COVID secure business, you have to balance this out with considering what the impact is on people's mental health. We have all lived through this pandemic for the last 14 months. You know, thinking back to over a year ago when, as a business in Morpay, we started doing COVID webinars. I don't think in a million years any of us would have still considered that it would be as it is this far down the line, and it's had an impact on everyone. So when you're looking at all your policies and procedures, it's absolutely right that you need to continue to do that. Seek the specialist advice from either an HR or a health and safety practitioner to get those policies right, to look at the individual circumstances and deal with them in a legally compliant way. But behind all this needs to be a consideration of mental health. And one of the biggest things that you can do to support the positive outcomes and positive support of mental health is around being communicative, being transparent about your plans to return to the workplace, providing timescales and giving your employees clarity, the chance to ask questions and the chance to raise concerns. A lot of these issues will be much better solved if they can be solved informally at the beginning, up front, before they become big issues. Explain how you'll be keeping the workplace clean and safe, and be ready to answer all those sort of nuanced questions that your employees may have. Think about how you're going to do this communication. Is it about having a group of employees that represent the rest of the organisation? Are you going to do it by email communication, one-to-one meetings? Think about what's most appropriate for you and your business. I mean, one of the things that we are looking at doing within MorePay to help with the planned return to the workplace is videos of the offices as they are now, because we are very well aware that when people re-enter the workplace, hopefully sometime after the 21st of June, that as it stands at the moment, the offices are going to look very different because of the social distancing and COVID secure measures. So we want to familiarise people with what that's going to look like. So we are going to do videos and tours, online tours, so that people can see what it looks like. And it's just little things like that that you consider, but that all goes to helping kind of a bit of more of a positive approach. And then the other biggest thing is to be primed for those signs of mental health issues. If you listen out for complaints of things like headaches, reports of poor sleeps, people may start to talk about increased alcohol consumption. Look out for those signs in your teams. As I said before, that can be more difficult to do if you are still in a home working situation, but it's about picking up on those small cues and seeing where you can help people. Does anyone have concerns about their performance or possibly seek reassurance? Are people seeming fatigued, confused, even teary or angry? Have you seen people avoiding meetings or calls? Are they keeping their cameras regularly switched off in meetings when they normally have them on? I just think this is going to be a real period of change for people. We were all very quickly thrown into the home working situation and had to adapt, and everything that it threw at us all. But now we are trying to do the opposite, and there are some businesses who did return for a short period last year, so they've already kind of dipped their toes into this, but there are some businesses like our own who haven't been in the office since March 2020, so this is a big step, and there are lots of considerations. We have, though, as a business, been supporting our customers with this. Last year, when restrictions did begin to ease and some businesses went back, we supported from both a health and safety and HR point of view in terms of kind of back to work and pieces of consultancy to help consider all these aspects. And we're certainly looking to reiterate that where we can help people, with the added overlay of the vaccine now, which obviously wasn't in place last year. It's another consideration. So lots of things to think about. I'm conscious that obviously we've given you a lot of information here, lots of things to consider. And maybe disappointingly without a black and white answer, but that's because this situation isn't black and white, it's ever evolving. There are so many considerations to actually make a decision, and there isn't one answer fits all, unfortunately. But all these issues can be worked through with the right policies in place, the right consideration, the right communication, and then where appropriate, the right input from either health and safety or HR to help you make any final decisions and put you in the least risky situation. Okay.
Thank you very much, Michelle. That was great. So I think we've got some time for questions now. So first question from Helen. I have a staff member who won't return to the office until everyone has had both vaccinations, and another staff member who refuses to have the vaccination at all. I need them both in the office for at least some days of the week. What options are open to me? It's a very good question, Helen.
It is a very good question, and obviously very topical given what we've been discussing. So in this situation, I would suggest that you'd first of all speak with the individual who's refusing to return to work until everyone has had the vaccination, to understand more of their rationale, and also to discuss and reiterate all the safety measures that have been put in place to make the workplace COVID secure. Vaccinations are one element of that, and they're not the totality of it. I think the other thing that's going to be really important to point out to them is that due to GDPR, information regarding an individual's vaccination status, you could not share the vaccination status of others with them. So you would be able to confirm that people in the organisations your organisation were or weren't vaccinated, and that is not something that you can give to them without breaking a very important GDPR rule. But I think until you understand their reasoning for it, you can't say whether their perception of the risk is actually reasonable or not. And going back to what I said earlier, it's all around getting to, is their perception of that risk reasonable? And you can't advise on the best way to deal with it. So start with that and then seek some more specialist advice. And with the person who is refusing to have the vaccine, then, as we discussed before, there are considerations to make. You cannot force anyone to have a vaccine, but there are things that you can consider. And again, it's encouraging them to take up that, making sure that you've got things in place that encourages them to take time off. And it's kind of dealing with each one separately.
There's been another question, I think a bit of overlap here from Neela, who so potentially similar advice, but she wanted to know, can an employee just outright refuse to work on the basis that they've not had their second vaccination yet? Is that grounds to refuse?
I wouldn't say that they can outright refuse. No employee has got the right to, completely refuse to work. It's not as black and white as that. You need to do some understanding, talk to them in more detail. I think the level of grey is whilst there's still this work from home advice, that makes it a little bit more difficult. But once that's been lifted, it's about encouraging how we get people back into the office. So again, talk to that person, find out if it is a legitimate reason, and then seek some more advice.
We've had a couple of people asking for copies of the webinar slides, so absolutely yes, I will include that with the webinar recording and send those to everybody by close of play today. Another question from Helen, which I think is a really good one and a really valid concern that I'm sure some of you will share. So she has said that she has some people who are based permanently in the office and others who are going to be working part-time at home and part-time in the office, so doing that kind of hybrid working. Obviously, part of the reason people want to return to the office is to connect with their colleagues, which Helen thinks is really important, and we agree. How can Helen make sure that people who often work from home don't treat those days in the office as a kind of social day and sort of ending up disturbing the people who are based in the office full time and need to do their work with a bit of peace and quiet? How can she manage that?
I think this is the best thing to do would be to manage this informally. Be very clear about your expectations about when people are in offices and what they are there to do and why they are there to be in the office. If you see any behaviours displayed that they are treating it as a social event, then my best advice we could give you would to nip it in the bud with them, and that informal conversation and remind them why they're there. If that doesn't work, then you can go down more informal routes, but be clear with people from the beginning.
Yeah. Okie doke. A really good question from Rebecca here as well. So this is obviously managing people who have young children. So she said that a staff member has asked to work from the office 2 mornings only so that they can look after their 1-year-old son at home whilst home working. Are they able to decline this request as they feel that his focus should be on his job whilst working from home and obviously not taking care of a child? How can Rebecca manage that one?
I would deal with that as a full flexible working request and run through the full flexible working process to make sure that you've got all the information you need, all the backup, all the processes, all the policies, and if you need support, then get HR advice.
Yeah, okie doke. Andrew has asked, if my employee has a vaccine and has a reaction and is off ill the following day, do I have to pay them full pay?
Not necessarily. They would be entitled to your normal sick pay policy, and if that's SSP, that's SSP, and you are contractually obliged to do nothing other than is in your policy. but it may be something that you want to consider. You could pay more if you wanted to, but I would stick to whatever is in your policy with regards sick leave and sick pay.
Yeah. Okay, another one here around sick pay from Richard, which is an interesting one. So if somebody gets COVID, but they'd refuse the vaccine, can they as an organisation withhold the company sick pay and only give them just the stat SSP?
That again is a very difficult one, because we've got to be careful not to be discriminatory or let people suffer a detrimental effect. I would suggest that that would involve a detailed conversation with either your HR advisor or a call into our HR advice line to talk that through in more detail. As I said before, there's certainly a thing around encouraging vaccines, and you can certainly do that, but to make a black and white decision without discussing it in more detail would probably be a bit hasty.
Yeah, okay. A question here touching on some of the GDPR stuff you mentioned. So Paula has asked, without a vaccine policy, how is the best way to approach staff to ask if they have had the vaccine? Can they do that, and how?
Yeah, you can ask staff, and if they are willing to volunteer that information, then that is great. If there are staff who are reluctant to give you that information, they do not have to. And again, it's thinking about what do you want to do with that information. That's what people will want to know. What are you asking this information for, and what are you planning to do with this information? Because there may be people who are perfectly willing to tell their organisation, yes, I've had a vaccine, but don't want that communicating to the rest of the organisation, because it is personal data. So if you are going to ask them, make sure you're very clear about why you're asking them and what you're going to do with that information. And again, this should be part of an overall policy, so probably needs some more detailed consideration and supporting to build that policy around what you're doing and why you're doing it.
Yeah. And a bit of overlap here, actually, another good question about this. So Andrea's asked if they can keep a register of who has and who hasn't had the vaccine. She said that we'd have to ask monthly due to the vaccine rollout, but can they have that register? Is that okay?
Yeah, there are in place and putting it on their databases. And again, if an individual is willing to give up that information freely, then that's absolutely fine, and they know that that's being recorded. But that's again where you really need to try and do this with an overall policy, and then you need to make a decision about what you're going to do with people who either refuse to tell you that information, or if they tell you they haven't been vaccinated and aren't intending on getting that vaccination, what are you going to do with that information? So I think there's some considerations that you need to make before.
Yeah. Question from Steph here. Is it expected that social distancing and other measures like this will be required in workplaces after the 21st of June, or do we think that that's all going to be done?
I can't answer that question at the moment. There is so much up in the air, especially with the new variant at the moment. I would say at the moment you should plan as is with the COVID secure workplaces, follow that route, and then if restrictions relax, then you're in a good situation.
Yeah, okie doke. There's still a little bit of time, so we'll go through a few more questions. I don't think we're going to get to all of them because we've had so many, but some really great questions that we could potentially take away and work into a bit of an FAQ document and share with you, because some really good stuff coming up. But one question here from Sandra: what would you suggest about an employee who doesn't want to use public transport to travel to work? I mean, presumably because of the fears around catching something there.
Yeah, just before I answer this, I am having a little bit of technical difficulty. So if I go on, it's because I'm having some technical network issues. But in terms of that, again, I would speak to the individual, speak to them about why they've got fears around public transport, and then see if there are any alternatives that you can put in place. So it might be that they could car share with somebody who lives nearby. Look at what alternative options you can do to help them get into work. And again, if there are no other options, it's looking at, is that a reasonable risk and a justifiable risk, and answering that question. Can they continue to work from home? Is that okay? If you do need them in the office, what other ways can they get into work? If they can't get into work, then it's asking that question and getting support on whether that is a reasonable reason for refusal.
Yeah, somebody else has asked a similar question, Rachel, around public transport, and she said, given savings on commuting over the year, would it be considered reasonable to expect staff to get a taxi from, example, across London, to get to work? Would that be reasonable, unreasonable under the circumstances?
I mean, that is down to an individual personal preference about how they want to travel. Obviously, it's looking at what measures have been put in place with public transport, and all their COVID secure as well. They have to abide by the rules as well. And then it really would be down to an individual preference. But again, if you get to a sort of a deadlock situation, then seek some advice.
Yeah, okay, wonderful. We'll do one more question. So for those who do not have the vaccine, this is from Rebecca, do businesses need to keep more controls in place at the workplace? I'm assuming she means, on a more sort of medium to long term basis. Do we think that we'll need to keep those controls in place?
I think that is an excellent point, and probably one that would be your counter argument to understanding that not everybody in the workplace may have had the vaccine. If you're going above and beyond what you need to do, I think that would be an excellent suggestion, and would be a really strong case for saying we have done everything, but the one thing you can't control is who takes up that vaccine. You have no right to do that. You have the right to decide what happens afterwards, but you're going to have to tread very carefully. So there's an extra layer of comfort in there for individuals if you are keeping to COVID secure rules, potentially beyond the date that you need to. So it's an excellent idea.
Yeah, wonderful. Thank you so much for your questions, everyone, and thank you, Michelle, for answering those. I don't know if you have been to the Morpay website Knowledge Centre. It's a really, really useful tool to find all of the resources that we've got. So our experts in payroll and HR are regularly writing blogs and supporting writing guides, and there's obviously all of our past webinars on there. There's upcoming webinars. It's jam-packed full of useful stuff, so you can search on your key criteria, or you can just browse the topics. There's lots in there on flexible working, some stuff that we did last year, and whilst the context is changing, some of the key elements will be the same, so do have a look in there. As mentioned, we have got a webinar coming up in a few weeks that's going to be all about flexible working and how to implement a hybrid working model. So if you've got questions about that and you're planning to implement something, then please do attend that webinar. I will send you a link this afternoon. And that's everything. Thank you so much for attending. We really hope you have found it useful. Apologies for any technical issues at our side. I think the webinar recording should be okay, so you can rewatch anything at your leisure this afternoon when I share that. Thanks so much, Michelle, and enjoy the rest of your day, everyone.